Dr. D, you were telling, obviously in your practice where you do cosmetic surgery and make people look younger, better feeling, you do Botox, and you also talked about fillers. Now, tell us the difference between Botox and fillers, because it looks to me that the Botox is filling you up. You put it in and a filler. Explain the difference to us people who don't know.
That's a very good question, because I often have patients or clients that come in and they're saying they want one thing, but that's not really what they need for what the effect they're looking to improve. I think a good way to look at it is Botox, or now Dysport. We call them neuroblockers. They soften the dynamic wrinkle, the wrinkles of expression. And the most common one is the one between our eyes, right here. We call it the frown line or the glabella complex. People look at that and
you don't seem to be frowning a lot, so I don't see anyone.
No. Men do have an advantage because their skin is thicker, so it kind of takes them a little longer for those wrinkles to show.
Okay.
So Botox will soften wrinkles of expression. If you can squint and form a wrinkle and you want to soften that, Botox or Dysport will soften that. On the other hand, a filler will fill in a depression or a crease that's there at rest. And the most common area when we're talking about fillers are what we call the nasolabial folds. These folds right down the nose here. As a woman ages, we have what we call the 3 Ds of aging. We have descent, we have deterioration of the skin with the brown spots and the wrinkles, and we have deflation where we actually lose volume. Well, the fillers replace volume, and by replacing the volume, we actually fill in spots. For example, these areas here, Botox will not touch them. I chuckle when I tell this to my clients. Do you want me to soften some of these things here? Well, if I give you enough Botox to soften these wrinkles, you would either drool or not be able to talk. Obviously, that's not something any person would really want. So these areas we basically fill with some kind of filler. And another popular area are the lips. Women who even have they don't have to have many necessarily thinning lips, but they want to have fuller lips to give a more sensual look. That is very popular for fillers.
I see. Okay. I see. So, is that filler going in exactly where the wrinkle happens, or because as you get that wrinkle here, obviously that wrinkle is here because it sags somewhere else or whatever. Like if I put myself up here, I'm not, that goes away. So does it fill you up here or like sometimes you have a knee pain, but the knee pain doesn't come because you have a knee pain. You have a problem because maybe your feet are like looking like a duck, and then your knee gets all. So basically, the problem comes from somewhere else. So when we have a wrinkle,
yes.
is the treatment right where the wrinkle is? Is it filling that actual wrinkle up like like if you caulk like a pothole in the street? Are you putting it right in there where it is, or are you putting it somewhere else?
Another good question. It really depends on the effect we're trying to achieve. See, when I get when a woman comes, and I say woman because it's mostly women, or although I do have men in my practice who come for cosmetic treatments, I study their face. I study how they're talking, how they're moving their muscles. Each person has, is unique. Just so like their face is unique, the way they express themselves is unique. And, I show them a mirror and I ask them to tell me, what are you looking to improve or what don't you like? And based on what they're telling me, based on the various services that I can offer, I know what to do, and I will show them what improvement will happen with what. Talking about fillers, do we put it exactly in the area of the depression? Sometimes yes, sometimes no. One of the exciting things about fillers, and I give credit to a Dr. Steve Mulholland out of Toronto, Canada. I had the pleasure of actually visiting his Medispa there, world-renowned doctor. He developed something called the Volumolift. And that is where we use fillers to create a lift. So when a woman, instead of getting a mid-face or some kind of face lift, we can actually create a literal lift or the illusion of a lift by using fillers in different locations. So we've done cheek enhancement. We can do a cheek lift, a jowl lift, even a lower lid or upper lid lift using fillers. So this is really another exciting new development that's happened over the last few years.
Wonderful. Now, how long does such a filler last? You fill it up, 3 weeks, 3 months, 3 years later, it's gone. And once it is gone, can one do it again? Or is it like with a bypass? There's only so many bypasses you can do before the doctor says, that's it, we can't touch it anymore. Shed some light on that.
Fillers can last from as little as a few weeks to as long as a year or more. The exciting thing, again, new technologies, more options are coming up for clients. Again, as I said, it's a really exciting time to be looking at aesthetics. We have most fillers will usually last at least 4 months, 6 months, even a year or more.
And once
after yes,
and then,
right.
And then
after,
repeated.
It can be repeated multiple times. There's really no maximum number of treatments. And with repeated filler use in a given area, it actually stimulates collagen, so that can have even a long-term effect. I'm not trying to say that if you get 4 filler injections, you'll never need another filler again, but it definitely stimulates new collagen, so that gives a little longer lasting effect.
Wow, so almost like as more as you do, slightly more it might work. Slightly longer, yes, it might work.
Yes, and actually even certain companies that promote certain fillers will say, now we guarantee, or we have FDA clearance for 18-month enhancement. And then in the fine print they will say, providing you get kind of a boost somewhere between 6 and 9 months. So there are people that are actually getting a year and a half worth of results when they get their initial treatment, and then they get almost like a little adjustment, like a top-up, so to speak, or a little extra, maybe at the 6 to 9 month mark.
Like a little maintenance, basically, a little.
Exactly.
Okay,
precisely.
Well, that sounds great. Wonderful, and no major side effects. By major side effects, I'm talking it doesn't ruin your kidney, your liver. You're not getting Alzheimer's because of it, because you're poisoning none of that stuff.
Good question. The fillers are becoming safer and safer. In the past, way back years ago, we have the actual collagen fillers, and there was a significant risk of even allergic reactions that actually patients had to get even tested before the treatment. The most common fillers that we use now, the hyaluronic acids like Restylane, Perlane, Juvederm, to mention the most common names, they actually consist of hyaluronic acid. That is something that every animal species contains in the skin, subcutaneous matrix. So allergic reactions are extremely rare, way under 1 in 1,000. Infection obviously is always a risk. Anytime we're breaking the skin, I've never seen it happen in a decade. It can happen. Bruising is always a possibility, especially people who take blood thinners. But I have done fillers on clients that, for example, will take a baby aspirin every day for a certain medical condition, and they really don't want to stop it. That increases the chance of bruising, but even in that case, bruising is usually not severe.
Okay, well, wonderful. That's good news. Thanks a lot for the information.
You're very welcome.